Understanding vaginal discharge, a natural phenomenon. Vaginal discharge is a normal and healthy bodily function. It plays a crucial role in maintaining a clean and healthy vaginal environment. This discharge, often clear or white, is produced by glands in the cervix and vagina. Its primary purpose is to remove bacteria and dead cells, effectively cleansing the vagina. Think of vaginal discharge as a self-cleaning mechanism. Just like saliva in your mouth, it helps to keep things in balance. The amount and consistency of discharge can vary from woman to woman. It can also change throughout your menstrual cycle. Many women experience changes in their discharge throughout their lives. Puberty, pregnancy, and menopause are all the times of significant hormonal shifts. These shifts are often reflected in the amount and consistency of vaginal discharge. Understanding these natural variations is key to differentiating between normal discharge and potential problems. If you ever have concerns about your discharge, it's always wise to consult with your healthcare provider. The why behind the white hormonal influences and the menstrual cycle. The appearance of white discharge is directly linked to your menstrual cycle and fluctuating hormone levels. Throughout your cycle, estrogen and progesterone levels rise and fall. These hormonal fluctuations cause changes in the cervical mucus, leading to variations in your discharge. At the beginning of your cycle, right after your period, discharge is typically scant. As estrogen levels rise in preparation for ovulation, discharge becomes thinner and clearer. This change in consistency facilitates the passage of sperm. After ovulation, progesterone takes center stage. This hormone causes the discharge to thicken and turn white or cloudy. This thicker discharge acts as a protective barrier, making it more difficult for sperm to enter the cervix. If you are not pregnant, progesterone levels decrease towards the end of your cycle. This decrease signals the onset of menstruation. Consequently, you may notice an increase in discharge, which may be white or slightly yellowish. Understanding these hormonal influences can help you anticipate changes in your discharge throughout your cycle. Recognizing these patterns empowers you to better differentiate between normal fluctuations and potential signs of infection. Deciphering the discharge types of white discharge and their significance. Not all white discharge is created equal. Understanding the different types and their characteristics is crucial for identifying potential issues. Thick, white discharge. This type of discharge is most common during the days leading up to your period. It's often described as being similar to lotion or cottage cheese. While this discharge is generally normal, a thick white discharge accompanied by itching, burning, or a foul odor could indicate a yeast infection. Thin, white discharge. This type of discharge is often observed during ovulation. It's typically clear to white in color and has a stretchy consistency, resembling raw egg whites. This type of discharge is considered fertile mucus and is a sign that your body is ready for conception. White discharge before period. This discharge is a normal part of your menstrual cycle. As your body prepares for menstruation, the discharge may become white or slightly yellowish. It might also have a thicker, more viscous consistency. This change is due to the influence of progesterone and is nothing to be concerned about. White discharge after period. It's common to experience some white discharge after your period. This discharge helps to cleanse the vagina and remove any remaining blood or tissue. As long as the discharge is odorless and doesn't cause any discomfort, it's considered normal. Causes and concerns. Common factors influencing white discharge. White discharge is a natural bodily function, but certain factors can influence its consistency, amount, and odor. Understanding these factors can help you maintain good vaginal health and recognize potential problems. Hormonal changes. As mentioned earlier, hormonal fluctuations during the menstrual cycle, pregnancy, and menopause significantly impact vaginal discharge. These changes are completely normal and usually nothing to worry about. Medications. Certain medications, such as antibiotics and birth control pills, can alter the balance of bacteria in the vagina. This alteration can lead to changes in discharge, including an increase in white discharge. Hygiene products. The use of scented soaps, douches, and feminine hygiene products can irritate the delicate vaginal environment. This irritation can disrupt the natural pH balance and lead to changes in discharge. Stress. Believe it or not, stress can affect your vaginal health. Stress can weaken your immune system, making you more susceptible to infections that can cause changes in discharge. Underlying medical conditions. In some cases, white discharge, especially when accompanied by other symptoms, can be a sign of an underlying medical condition, like bacterial vaginosis, yeast infections, or sexually transmitted infections. If you notice any unusual changes in your discharge, such as a change in color, consistency, or odor, or if you experience itching, burning, or pain, it's essential to consult with your healthcare provider. Section 5. When white means trouble. Recognizing abnormal discharge and potential infections. While white discharge is typically harmless, certain characteristics warrant attention. Recognizing these signs can help you seek timely medical advice and prevent potential complications. While white is often considered normal, a change in color, especially to yellow, green, or gray, could indicate an infection. A fishy or unpleasant odor accompanying the discharge is another red flag. This often points towards bacterial vaginosis, a common vaginal infection. A sudden shift in consistency, especially to a thick, curd-like texture, might indicate a yeast infection. Experiencing itching, burning, redness, or swelling in the vaginal area, along with changes in discharge, requires medical attention. Pain or a burning sensation during urination, coupled with abnormal discharge, could be a sign of a urinary tract infection or UTI or other infections. Remember, self-diagnosing is never recommended. If you experience any of these symptoms, it's crucial to consult your healthcare provider for proper diagnosis and treatment. Section 6. Maintaining vaginal well-being, effective treatments and home remedies. Addressing abnormal white discharge often involves identifying the underlying cause and treating it accordingly. Here are some common treatment approaches and helpful home remedies. Yeast infections, a frequent culprit behind thick white discharge, are typically treated with antifungal medications, available as creams, ointments, or oral tablets. Bacterial vaginosis, another common cause of abnormal discharge, is usually treated with antibiotics. These medications help restore the balance of bacteria in the vagina. Probiotics, available as supplements or in certain foods, can help restore the balance of beneficial bacteria in the vagina. While not a replacement for medical treatment, some home remedies can provide relief from symptoms. These include: opt for cotton underwear to allow for better airflow and reduce moisture buildup. Avoid using scented soaps, douches, and feminine hygiene products as they can irritate the vagina. Gently rinsing the vulva with warm water can help soothe irritation and remove excess discharge. It's crucial to remember that self-treating can sometimes worsen the condition. Always consult your healthcare provider for an accurate diagnosis and appropriate treatment plan. Section 7. Preventive measures, practical tips for a healthy vaginal environment. Maintaining a healthy vaginal environment is crucial for overall well-being. Incorporating these simple yet effective preventive measures into your routine can significantly reduce your risk of developing infections and maintain a balanced vaginal flora. Wash your genital area daily with mild, unscented soap and water. Rinse thoroughly and pat dry. Opt for cotton underwear as it allows for better airflow, reducing moisture buildup and the risk of infections. Always wipe from front to back after using the toilet to prevent the spread of bacteria from the anal area to the vagina. Douching disrupts the natural pH balance of the vagina, making it more susceptible to infections. Using condoms consistently and correctly can significantly reduce your risk of contracting sexually transmitted infections. Drinking plenty of water helps flush out toxins from your body, including the urinary tract, and can help prevent UTIs. A balanced diet rich in fruits, vegetables, and yogurt containing probiotics can support a healthy vaginal flora. By incorporating these preventive measures into your daily routine, you can significantly reduce your risk of developing vaginal infections and maintain a healthy vaginal environment. Section 8. Embracing vaginal health. Do's and don'ts for women of all ages. Maintaining good vaginal health is a lifelong endeavor. Here's a breakdown of essential do's and don'ts for women of different age groups to ensure optimal vaginal well-being. Educate yourself about your menstrual cycle and normal vaginal discharge. Douche or use feminine hygiene products as they can disrupt the natural vaginal balance. Practice safe sex and get tested regularly for STIs if sexually active. Ignore any unusual symptoms, such as itching, burning, or abnormal discharge. Schedule regular pelvic exams and pap smears to screen for cervical cancer and other issues. Smoke, as it can increase the risk of cervical cancer and other health problems. Practice Kegel exercises to strengthen pelvic floor muscles. Be afraid to discuss any concerns about your vaginal health with your healthcare provider. Use a vaginal moisturizer if you experience vaginal dryness due to hormonal changes. Assume that vaginal dryness is a normal part of aging. Discuss treatment options with your doctor. Continue with regular pelvic exams and pap smears as recommended by your healthcare provider. Hesitate to seek medical attention for any unusual vaginal bleeding or discharge. By following these age-specific recommendations, women can proactively manage their vaginal health throughout their lives. Section 9. Prioritizing reproductive wellness, a lifelong commitment. Understanding and caring for your reproductive health is a lifelong journey, not a destination. By staying informed, practicing good hygiene, and seeking timely medical advice, you can ensure optimal vaginal and reproductive well-being at every stage of life. Remember, your body is your own, and understanding its natural rhythms and fluctuations is key to maintaining good health. Don't hesitate to reach out to your healthcare provider if you have any questions or concerns about your vaginal health. Early detection and treatment are crucial for preventing complications and ensuring a healthy and fulfilling life.